Good afternoon, and thank you again for joining. I'm Dr. Janina White, Deputy Public Health Authority with the Houston Health Department. And this is our Measles 101. So, as of today, April 22nd, now remember the Department of State Health Services is reporting updated numbers every Tuesday and every Friday. We actually have the numbers for today reporting for Tuesday. So, at this time, for measles, there's 624 cases have been confirmed since late January. This is an increase from our last report of 27 new cases from the last reporting of April 18th. It's important to know less than 2% or fewer than 10 of these confirmed cases are estimated to be actively infectious since their rash onset date, which was less than a week ago. So remember, people are infectious 4 days prior to the rash and 4 days after the rash. In this current outbreak conversation, 64 of the patients have been hospitalized, and this number is the total number of people hospitalized over the course of the outbreak. It's not the current number of any one person that's currently in the hospital. There have been, unfortunately, 2 fatalities of school-aged children who lived in the outbreak area. And these children we know were not vaccinated and had no known underlying conditions. So due to the highly contagious nature of this disease, additional cases are likely to continue to be reported and occur in that outbreak community. And we'll just keeping you informed and updated. So as I wait for any comments or questions, I did want to go through maybe a few. Hi, Jeffrey. Good afternoon. Thank you. I did want to kind of break this into maybe like some myths and truths, because when we're not on the social live, we are getting questions asked. And so one question or one myth is that only children can get measles. And that's not true. So just let's revisit this. Most adults who were born before 1957 are considered immune because at the time there was widespread measles globally, certainly. And so there's an expectation that you either had it or you were exposed to it. Remember, between 1963 and 1967, there were 2 options to get vaccinated. One of those vaccines was not a live vaccine. And so there's a thought also that individuals, if they had gotten that inactivated vaccine, they would actually need to receive 2 doses now of getting the measles, mumps, and rubella vaccination. They need to get 2 doses. If you've never had the measles, if you've never had measles or you haven't gotten your vaccines, then you should get vaccinated. And this is important to highlight because when we look at the outbreak community, so let's go through some of the numbers in the outbreak community. 0 to 4-year-olds, there's been 186 confirmed cases. When we look at the 5 to 17-year-olds, there's been 236 confirmed cases. But then when we look at the 18 and over, there's been 178 cases. So this highlights adults can get measles, and it's important to know your vaccine status. And if you've not been vaccinated, it's important to get vaccinated. And I also want to highlight that when we talk about the outbreak cases, well proportionately, 602 of those individuals are unvaccinated or they just absolutely didn't know their vaccine status. And remember, the vaccine is safe. So if you're not sure, but you might be getting an extra dose, the vaccine is a safe vaccine. How about we've had this myth number 2. Everyone should get the measles vaccine. So the truth is, not everyone is able to get the measles, mumps, and rubella vaccine. So babies younger than 6 months, they're not able to be vaccinated. People who've had immunity, those born before 1957, or have laboratory evidence of immunity or confirmed disease, would not need to get the vaccine. Patients who have a weakened immune system, so that's something to talk to your doctor about. Certainly your immune condition, and there's several, medical conditions we would declare as like an immune compromising condition. Pregnant women can't get a live virus vaccine, and those who are on medications that suppress the immune system should not get this live virus vaccine. So instead, those particular group of individuals are relying on us to get vaccinated so they stay protected because they can't get vaccinated. And then always with any sort of medication vaccine, right? If you've ever had a serious allergic reaction, you would not be a candidate to get the sort of the second dose of this vaccine for those reasons. Okay. Another myth we has come across to us is there are natural ways. This is the myth. There are natural ways to prevent measles, so I don't need the vaccine. And the truth is, there is no natural preventive measures for measles. None. I can't stress this enough. Vaccinations are the single most important way to protect yourself against measles. Some patients, we understand, are very concerned about this vaccine, but that we understand because of that, it's very difficult to sift through information to know what's true and what's conflicting out there. And so you really want to go to reputable sources and get information. One of the things we've heard is vitamin A is a treatment for measles, and vitamin A cod liver oil is not a treatment for measles, and actually can create some serious consequences if it's taken in too much, if it's taken in too much of a large dose, taken not as recommended. So it's not like it can't be without some challenges and problems of taking cod liver oil in too much of a dose, or that perception that there's no big deal if I take that. And it's not a treatment. Oxygen is not a treatment for measles. It's supportive care. There's been conversations about what we call inhalers, certain medications that get inhaled, particularly for the respiratory perspective if the child's in the hospital with pneumonia. And again, it doesn't treat measles. These are supportive strategies and tools and medical resources that help a patient who finds themselves hospitalized. So a question about a pregnant person who is unsure about their measles immunity. So for someone who's pregnant, when you see your OB-GYN, they will often do appropriate lab work. They look at the rubella titers, measles. They look at titers is what they do. And based on your level of titers, they'll give you additional guidance. Because a pregnant person would not be able to get this live virus, one of the strategies would be is ensuring that the people around them are appropriately vaccinated. You may want to consider some, if you were going to travel to areas that had outbreaks or had endemic exposure, maybe you would hold off those type of travel decisions. And then again, if for some reason there was a risk that the person was exposed, there is what we call post-exposure prophylaxis medication that a pregnant person could have access to. So there's good news in that there is some resource and some medication available. But to your point, you want to just do all the proactive preventive measures as possible. And that's also the question for looking at women who may be contemplating pregnancy, contemplating their childbearing considerations. And so if you're thinking, in a couple of years, I think I want to really think about my life plan. When do I want to have children? You would maybe want to know now your status and make sure you're vaccinated. And that's a great preventative visit that, we love. I'm an internist and pediatrician, and those are fun appointments to really educate our patients. And I know we're getting close to the end of time. I just want to thank you all so much for joining. Again, we love the time we have together, and we love the questions that we get when we're not online. And just keep those coming, and we look forward to seeing you next time.